Let's say 70% of a workplace like Cargill is racialized. That means that if there's a cluster infection, which there was at Cargill, then the transmission of that cluster infection will also take on racialized forms.
Canadians are asking medical authorities to start tracking the race and background of people who are contracting COVID-19. Numbers from the U.K. show that Black Britons are twice as likely to die of coronavirus, while stats from the U.S. show that COVID-19 is spreading much quicker in Black communities. But we don't know if Canada's minority populations are at risk because only a few local health authorities are currently tracking the race and background of people who are getting infected.
Just because a community has a disproportionate number of cases does not necessarily mean that they're not following orders, that there's something cultural about the disease. It might give us a sense of the vulnerabilities that are at play.
High River, Alberta's Cargill plant is North America's single biggest outbreak, with more than 900 cases and 2 related deaths. Employees say 60 to 80% of the workforce is Filipino. Given the numbers of ethnic minority Canadians in essential service positions, further data could show if certain Canadians are taking on the lion's share of the risk.
Now that this pandemic is happening, we are seeing that these people are the ones that are really sustaining the systems that we need, right? Or need to be fed or need to be cared for. And so I think these folks deserve better than the way that they're being treated at this point.
So there's international evidence. There's local evidence from a different epidemic that says, hey, we should be collecting this data. And I think given all of that, it's good that Ontario and Toronto and Peel and other health units have now decided they should collect this data because it will help us produce a better pandemic response.
Dr. Quam McKenzie is an expert on health equity and says Canada already knows some communities will be harder hit. During the H1N1 outbreak, McKenzie says stats showed East Asian Canadians were 3 times as likely to get infected. Among South Asians, that rate was 6 times as likely to become infected, and that rose to 10 times among Black Canadians.
So there are all sorts of things you need to think about. But the first thing you need is the data so you can sit down and work out what's going on. We have been literally flying blind.
However, collecting that data is just the start. Dr. McKenzie says once we have that data, healthcare initiatives can be focused on specific communities to help curb the spread of COVID-19 there and among all Canadians. However, that's only possible if we have the data to begin with. In Ottawa, Xiaoli Li, City News.